We're back with Dr. Oronde White. Are there any cutting-edge technologies on the horizon with some of the conditions that you treat that you can share with us?
Yes, you know, there are quite a few cutting-edge technologies coming out. And some of the more exciting developments are in molecular biology and gene therapy, which are promising techniques.
Well, that's great with the cutting-edge treatments that are coming to us, but we have to get to that point, and we have to start by practicing some preventive measures. Let's talk about preventive medicine. How do you define it?
Well, I define preventive medicine as taking actions and measures before you develop any symptoms of disease to try to maintain your health. And a lot of ways of going about that. Nutrition is critical, but nowadays, one thing that's being overlooked, in my opinion, in the medical field is the role of industrialization in our environment and helping to bring about a lot of illness that many people suffer from.
Let's talk a little more about prevention. What are some of the conditions that we need to be concerned with in the Metro Detroit area?
Well, here, you know, everybody knows that Detroit is known as the Motor City. And, you know, we've led, you know, world revolution as far as technological advancements and all of these great, wonderful things. But that has come at a price. And one of the prices is that all of the industrialization of our area in particular places us all at elevated risk of certain types of health problems. And in particular, we still have a lot of people working in steel plants and industrial facilities who have exposures to a lot of chemicals in very subtle quantities that they may not, you know, feel on a day-to-day basis. But over time, this can catch up to any of us.
We need to take a break, but we'll be right back after this.
I've been a patient of Dr. White for about 9 months. And I found that I was a person, because of my weight and a number of things, had multiple medical problems. And I felt that Dr. White was one doctor who not only gave me the time, but gave me the information I needed to make the improvements to make my health better. I'm excited about being a patient of Dr. White's. And for the first time ever, I feel as though I can accomplish some of these goals that's going to make me a better person.
I'm a patient of Dr. White's. And as a woman, I don't know about you, but I feel like I need special care. I need a doctor that's going to listen to me personally. Someone that's going to sit down, take the time, and give me special care when I'm sitting in his office. Well, I found that with Dr. White. So if you're looking for someone that's going to be patient, thorough, and is going to do the job the way that you would like it done, then you need to go see Dr. White.
Oh, you know what? I want to make the difference. When people come in here, especially with weight loss, that is my passion, teaching people, educating them more than weight loss. I don't use the word diet, it's behavior modification and the lifestyle change. And when I see that, I've had patients, they have lost so much weight and they have changed their lifestyle. That is the most thrilling thing. End of the day, when I go home, that's what is gratifying for me.
Hello, my name is Dr. White here at the Lighthouse Clinic.
And I'm Latoya, physician assistant here at the Lighthouse Clinic. Come see us here at the Lighthouse Clinic, where you'll receive the best health care at a great price.
Welcome to the Health Resource Media Network, also known as HRMN. The program was created to provide information on various forms of healthcare services. I'm Ursula Darby. Today we'll be spending time with Dr. Oronde White, the founder of the Lighthouse Medical Clinic located in Southfield, Michigan.
Dr. White has proven himself to be very dependable. He takes his time and explains to the patients what is going on. Sometimes it may go over your head, but by the time he leaves out of that room, you understand thoroughly what he is explaining to you. It even gives you the information to take it and consider your choices of treatment. I admire Dr. White and what he's done for his patients, especially me, and I would recommend any patient to come to this office. He goes beyond the call of duty. He will tell you that he's there to help. And I know he's done things that sometimes attending physicians do not do. And I am a witness that if you do need a good doctor, this is the place to come. He treats you with respect, but at the same time, he treats you like a friend. And I am glad that I looked in the yellow pages on that Saturday and found this practice, because I'm standing here as a result of it.
We're back with Dr. Orande White from the Lighthouse Clinic in Southfield, Michigan. Let's talk about some of the conditions that you treat. What are the most common types of conditions that you are treating right now?
Well, most of the conditions that I'm treating now relate to high blood pressure and cardiovascular disease, obesity, diabetes, cancer, a wide range of health problems.
Doctor, most of the conditions that you named are primarily conditions that affect the African American community, meaning that most of them are hereditary. Is there anything that people can do to try and prevent getting some of those conditions, even though it may be hereditary?
That's part of the reason why I take the approach to medicine that I take. And that is that it's very well founded that genetics and heredity play a huge role in health, wellness, and disease. But something that is often overlooked is learning, behavior, and habits. And this is something that is extremely difficult to tease out oftentimes, that all of this disease isn't necessarily due to genes. But poor eating habits are critical in the role of developing disease and in people's ability to stay healthy. For example, from the time that we're born, we all come into this world like a blank sheet of paper, and we know nothing. And who we learn from principally are parents. And we basically adopt all of their habits just by watching them. And that's the most powerful learning that all of us do. But if your parents have poor habits, then you will follow in their footsteps and develop a lot of the same health problems that they develop that isn't necessarily genetic, but it's an interaction between a person and their environment. It's about choices and decisions. It's about what you eat, how you live, and this is where I've been able to make a big difference in a lot of my patients' lives, is explaining to them how those types of choices make a huge difference in their health.